Hi you guys, how are you? Beautiful day today outside, very sunny. I wanted to start doing a blog regarding anything and everything, especially regarding nursing. I am a new nurse grad. Um, I started working just a few months in a local hospital here in South Florida, the sunny South Florida. And for all my new nurses out there, I just wanted to tell you what to expect and what not to expect when it comes to new nursing. When you're a new nurse and you hit the floor on your own, you don't know a lot of things. You do have lots of questions. I still have a lot of questions. I've been practicing nursing for about 4 or 5 months, I think. Don't quite remember well, but I'm a novice nurse, and at the very beginning, I had questions like back to back, to the point that I was afraid that people will, the nurses will start talking, crap about me. Oh, she has so many questions. Does she know what she's doing? Blah blah blah. I never care about that. Well, I don't think that never happened that I'm aware of, but I don't really care much about that. I just care about being a safe nurse, and safety for my patients is my number one concern. So I do ask questions. I asked tons of questions when I was new, all the time. I would go with my car to the nurse station. I would ask my charge nurse. She would show me how to do things. I would ask people around. I would text people. We use phones, of course. We can text each other on iPhones. And I would call the pharmacy if I also have any questions. They were very good at it, directing me after for what to do. And I will use my phone to Google. You guys, Google is your best friend. And I remember, my days off, I used to go back to my books, do a little bit of research. I would, go to YouTube, watch videos. The very beginning is tough. And this is something that I want you to understand. Other nurses that work with you, they're not going to babysit you. I'm telling you this because not because you're a new nurse, don't think that they're going to be helping you all the time. A lot of times they're busy. Even if they want to help you, they can't. So you have to find other resources and be a little bit more proactive and get your job done. Because if you don't get your job done, and then you get behind. And if you get behind, once the shift change comes, you'll never leave the hospital. Never. Oh my goodness. I used to leave the hospital so late when I was a new nurse. I would take my whole time documenting. I think I had a hard time documenting, but that comes with practice, like everything else. Like every single skill in nursing, it comes with practice, okay? So expect to ask questions. This is what this video is about. Expect to ask questions. I've asked questions to every single person that I work with. I cannot tell you a single one person that I have not asked a question. Ask questions to everybody. Some people are nicer, some people are not. Some people will tell you, I don't know, when they do know. But you'll find out who those people are. Some people will tell you the wrong thing. Although this is something that doesn't really happen too often. I guess what I'm trying to tell you is be careful who you ask questions, okay? Some people hide and they're very quiet, and when they know you're new, they try not to interact with you, so to prevent questions. But guess what? I don't care. And the quieter you are, the more I want to talk to you, because it's kind of weird to work with someone who doesn't talk to you, right? So I'll break the ice. And how do I break the ice? By asking questions. Man, they gotta love me in the hospital because they probably know me for asking a lot of questions. Like, really. So now, after a few months, I feel a little better. I still have a long way to go of many, many years in nursing. I still don't know it all. I probably won't know it all. I still feel that some nights, because I work at night, some nights I don't even know what I'm doing. If I have an order and I do not understand an order, was it discharged already the medication? Was that order supposed to to run or to be on hold? Or a lot of times the orders are not as specific. But guess what? All these nurses that have been working there, they know what they meant. But I don't. Do not be afraid. Ask questions. Ask questions, because that is how you learn. And at the end of the day, you want to do the best job possible. At the end of the day, you want to be a safe nurse. And you want to go home and you want to know inside deep in your heart that you did the best you could. And you didn't kill anybody, you didn't harm anybody, you didn't make any medication mistake. And there are silly mistakes that are acceptable, especially when you're a novice nurse. But as long as you don't harm anybody and it's not a big thing, do not feel guilty. You're still learning. It's a very long learning process. Nursing is not a nurse office job that you sit there and you ask questions, but you're trying to learn, but you learn every day, and you just sit in the computer and printing paper, whatever. Nursing is you're dealing with life, and any error, it costs people's life. Especially my unit is a step down ICU. So I do have ICU patients that I take care of, and some of them are so critical that I have to ask questions and I have to be very careful, because really they're so fragile that any little thing might harm the patient. So with this type of population at the hospital, I have to be very, very careful. Very careful. So this video is not too long. It's a short video because I want you to know what to expect. And the point that I'm trying to make here, this video, is expect to ask questions. Do not expect everybody to help you, because not everybody is as helpful. But I think the majority of the nurses or senior nurses nowadays are willing to help people, or even the new nurses, but the ones that they're working already for a year or two, they're willing to help people because they remember very well they wore your shoes not too long ago. And so, and also when you learn and you know how to do something, and when you feel a little bit more relaxed, not that you should feel relaxed in nursing, that never happens, that never should happen, but when you feel a little bit better with your skills in nursing, with your job in general, if you see somebody new coming into the unit, they're also a novice nurse, just help them too, give them tips, because they're gonna need it. They're gonna need it, and that person was you not too long ago. Oh, my hair is a mess. My hair is always a mess, you guys. I have hair problems every day. But anyways, I just want to wish you guys, all your nurses out there, good luck. I just want you to ask questions. Don't be shy. You can't be shy in nursing. I mean, maybe your personality is a little bit shy, but don't be too shy, because really, nursing, you have to deal with so many people. You have to talk to so many people that I guess you're gonna, learn not to be too shy, because you have to speak out also. Sometimes they give you assignments that are not that fair. I don't know. And sometimes you have to speak out for yourself and for your patients, because guess what? If you get assignments that are not fair, then there are patients that their safety is your concern, so you can be provide, that kind of safe to your patients. So you have to speak out for them and for yourself. All right, you guys. So that's it for now. Just a little bit of a tip, ask questions. Don't be shy. And if you're shy, but still ask questions. It's okay. Nobody gets angry or mad for you asking questions. Never happened to me. And a lot of times those who doesn't really talk or hide from you, they ended up being your friends, because you were the one who break the ice, even if it was by asking questions. So it's always a good thing for you, for your patients, and for your staff. So be blessed. Until next time. Bye.